Good morning, everybody. I'm trying a new angle today. Let me know what you think about it in the comments. First thing I want to point out is this right here is my sister-in-law, Marianne. And when Michael was on his way to Sunnyview, I don't know exactly when this happened, but he told one of my nieces that Marianne and his mother were with him and that he was in Florida. And the main problem with that is that Marianne is currently sitting on the mantle under the television in the living room. If you're slow on the uptick, she passed away a couple of years ago and she was cremated. I'm sorry if that sounded like a flippant comment, but you do have to have a sense of humor in times like this. And anybody in the medical profession will tell you the same thing. They all make jokes like that. And I'm not trying to have fun at my husband's expense, but it's the kind of thing you do to keep sane. And so I apologize if this sounded like a really off joke, but just understand I wouldn't have done it in any other circumstances. And Michael knows that he was hallucinating. He knows that he wasn't actually in Florida. He knows that his mother and his sister-in-law are not with him. Or he knows that my mother and sister-in-law were not with him. But it is okay to make a joke like that every now and again. You do have to have a sense of humor in times like this. I'm not being sponsored by that company either. I just use lens wipes for my glasses, if you were wondering. So I'm going to take a small break from talking about Michael today, just because I can't stop ranting when I go on about the stroke, and I'm trying to focus on every day going forward. Just going to do a quick shave just to get the 4 o'clock shadow off. Today is going to be a long one at work, I know, because today is the first of the month, and the store is going to be crawling with people getting their benefits. And let me just be really clear. I know I've said this before, but I don't have any issue with anybody who is on any sort of assistance, because I've been on it myself. And it's none of my business what anybody spends their benefits on. That's between them and the government. But I do get tired of the entitlement that some of them behave with, because there are some people who know they're getting benefits that they may not necessarily be entitled to. You can, like in my lifespan, I can count the number of people I know of who are actually penalized for EBT or benefits fraud on my hand. And I'm not saying it doesn't happen often. I'm just saying that, well, it doesn't. As long as they meet the conditions on ink and paper, most of them are going to be on those benefits for quite a while. And so a lot of them know what they're doing. And yeah, I know people do abuse those benefits, all right? It happens. I suppose the thing is it's when they start acting like they can get away with it. It's when they know they're doing it. And have you ever heard somebody say, or have you ever, you might have done it yourself. You might have said, well, I've been doing this all along and I never got in trouble for it, so it must be okay. That's the mentality they have. If they get away with something, they think, oh, well, I can get away with anything. And that's great logic up until the point you can't get away with it, and then where's your bravado up until that point? You might even say something stupid like, well, I didn't know it was against the law because I've been doing it all along, which is basically incriminating yourself. I'm not a suck up, but I am very much a by the rules kind of person. Like, if I'm told that this is the way something has to be done, I will do it that way. Not because I care if anybody thinks I follow the rules or not, but because I've been in trouble enough times to know that sometimes you just can't take that chance. And I don't know, but I'm moving on past that. I do get tired of the people that brag about, like, look, there's no shame in being on any kind of assistance. There's no shame in seeking it out. And there's no shame in staying on it for a long time. I do take issue with the people who remain on EBT benefits long after they don't need them. Like, as soon as I had a job and as soon as I was able to pay bills and save money, I got off it. I stopped taking advantage of the service I no longer needed because I know that while I'm on it, other people will not be. It gets harder to get on those services. It's just, I don't know, maybe I'm wrong, but I feel like I shouldn't be using benefits that other people need. And I can deal with a busy day at the store. What I have a hard time dealing with is when my one other coworker who will be there tonight flakes off and doesn't focus on what they're supposed to do, so that I wind up getting stuck in the store a little too late because this person doesn't prioritize their schedule and doesn't prioritize their tasks. And just like I'm not a suck up to the government, but I'm not a company man. I don't suck up to this place I work for. But I do try to be considerate of my coworkers. Like yesterday when I had a number of tasks on my plate, I stuck to those tasks so that when it was time for my supervisor to break down the registers and count the deposit, he didn't have to worry about anything else not being done. And it just gets frustrating sometimes. But I'm trying not to jinx it. I'm trying not to psych myself out. I just know today is going to be a difficult day. So I'm going to go forward and take whatever comes. I'm trying to get a ride to Sunnyview tomorrow to see Michael. I'll let you know how that goes. I got to remember to bring his Skechers. Because he can't go for a walk outside the hospital without shoes. But, all right, and I do want to add, I do want to say that I got my first donor on the GoFundMe campaign. I'm going to include the link in this description below. I'm just raising money so that when Michael is finally discharged, I can actually we can actually pay a huge chunk of that bill off. And the initial amount of $12,000, that's the goal amount, $12,000. I don't know how much the final bill is going to be at the end, but I feel like that will either cover it completely or it will take a huge chunk of it off entirely. Whatever is left from that $12,000 is either going to go towards other things that Michael needs, like at-home healthcare, any aids we need to buy for the shower and for him to get around. Paying for transportation, whether that's a professional service or whether it's comping gas to my family members and friends who will be here for him, because he's gonna need people here when he comes home. He's gonna need some people around, and while I'm at work, I'm gonna need somebody to stay with him. And even if it's his family and friends, I want to be able to compensate them for their time, because I'm also going to try to find a way to get paid to be home with him as much as possible. I know there are services out there. I just don't know how to go about applying for them. And I don't know what his short-term disability situation is going to be like. But either way, I think we all can agree that healthcare, any kind of healthcare, is expensive. So whatever is left of that $12,000 after we pay the bill, that's going to go towards all the necessary expenses, like, of course, also paying for the ambulance ride. That's going to be a penny. And I'm still working, so it's not like I don't have a source of income. So I don't want anybody to think I'm going to misappropriate any donations that go to this fund. It is all going to be for Michael's benefit, every single penny of it. And I'm not going to take a penny out until the day comes that he is discharged from Sunnyview Rehab. So if you can take a look at that GoFundMe and feel free to pitch in a few dollars. I'm not asking for huge donations. And if you're not willing to donate, because I know there are scams out there, and I know that for whatever reason, some people just are unable or unwilling to contribute financially, and I'm not judging either way, but if you're unwilling to do that or unable to do that, if you could share the GoFundMe on your social media or anywhere where it's going to get a lot of eyes on it, that would be really awesome. If you could like and share this video and like and share my other content as well. If you could subscribe to my channel, that would help me get closer to 1,000 subscribers so I could eventually monetize this channel. I'm doing everything I can to be as self-sufficient in this as possible, but I am reaching out and asking for help. So I just want to thank everybody for your support so far, both emotionally and otherwise. This has been a challenging time, and it's going to continue to be a challenging time. And I'm trying to take on a lot of responsibility. I'm trying to do a lot of things I've never done before. And I'm just asking for this little bit of help. And that's all that is. Thank you once again. Have a great day. Be safe. Treat each other with dignity and respect.